Hey, I'm Luke Schellenberger. I'm an ear, nose, and throat doc. So patients come in sometimes complaining of nasal blockage. Can't breathe through their nose. They've got stuffiness and congestion. It's really amazing to me that people go as long as they do getting used to breathing through their mouths. Just being able to breathe through my nose is something I take for granted. And patients sometimes come in and say, I've just had this for years. And now it's bugging me enough that I want to get something done about it. Well, there's a couple of things that we can do when patients come in. Just a simple thing that you can do before you're even seen in clinic, and that's to try a nasal steroid spray. Like Flonase or Nasacort, those are the two that come to my mind, being over the counter. The generic prescription is called fluticasone for Flonase. But try that out. Now, it does take a little bit of time to work. It's not something that you're going to just try and immediately see an effect. Give it a good, 3 weeks or so. Now, if that doesn't work, be happy to see you. People a lot of times ask, why am I so stuffed up? Two most common causes are swelling in the tissues in the nose. There's a certain structure called the turbinate that is often a culprit. And a swollen or enlarged turbinate is an easy thing to fix. Another is a septum that's deviated. Now, patients a lot of times say, I don't remember being hit in the nose. Why would my septum be deviated? I think in the majority of situations, it's just septums can grow where they're not straight. And if you just think about it, cars that are going on a straight highway have an easier time and go faster than cars that are going on a real curvy highway. You have to slow down, and the air has to slow down when it goes around your septum. So straightening the septum, reducing the turbinates, and there are other things and other techniques we think about, and we'll see when we look in your nose when you're coming in. Those are simple and easy things to do. Outpatient surgeries. And what's really nice about these relatively straightforward surgeries, they're really effective. My experience is that probably around 95% of patients who have their septum straight and their turbinates reduced will breathe a lot better and will come back in their post-operative visits and say, I've never had this open of an airflow through my nose. Again, something that a lot of people take for granted, but really makes a big difference in how people live. So, if you're having a lot of blockage in your nose and you've tried a nasal steroid spray like Flonase or Nasacort and it's not working after several weeks, give me a call. Be happy to take a look at things and see what we can do about it. Okay?